Thank you for listening today on Revealing Wholeness, sponsored by Infinity Whole Health. Check out our website at infinityWholeHealth.com, where we are revealing the eternal in each individual, the infinite in the individual. The creativity is made manifest. Limitation is let go. Now, here's your host, Dr. Troy Munson.
Hello, everyone. I'm Dr. Troy Munson at Infinity Whole Health. We're going to be talking about skin and what our skin is telling us about our health or lack thereof. And so some of you have heard that, well, the skin is the largest organ of our body. And while that is true, it really is a window into a lot of other systems. Now, classically, I've always heard in health realms that the skin is the window to the liver, but it can be much more than that. And tonight we're going to explore those ideas as we go through the process of seeing why we have what we have on our skin. What does it tell us? And so for what it's worth, the skin itself, there is things that you will see on it that will appear and disappear as things get better or worse. And I want to cover a myriad of topics of things that you'll see commonly, like bruises or tattoos or skin tags. All of that we're going to cover. And so buckle up, we're going to go at full speed now. And so my first and foremost, the thing I love to look at most on all my clients' body is the skin, but if they have little red spots on their skin. So if you have the ability right now to take a shirt off, women, if you're in a private area, even remove your brassiere, but also look on inside of wall of chest, underarm, through all the upper chest, even the abdomen. If you can see on the neck, you will find even on the inside of the leg, little tiny red spots. And those red spots are called cherry hemangiomas. You can look them up on Google. I thought about sharing a picture of one, but none of them looked really that great. You see a picture blown up of a little red spot's like, whatever. But when you can kind of step back and see that there might be 15 or 20 in a section where you can see an armpit and a shoulder, you're like, wow, that's a lot of red spots. And when I first started working on my health a little bit deeper, about 6-7 years ago, I actually counted how many were on my body. There were about mid-30s. I was like, wow, that's a lot of little red spots. And as I started eating less and less grains and sugar, I watched all those red spots go away within about 2 months. And what a cherry hemangioma is when we eat a lot of sugar and grains, and so we're putting more and more sugar into our blood, that irritates our blood vessels. And the blood vessels themselves now swell and they'll pop out to the surface of the skin, and we see it as a tiny little red spot. Now, its close cousin is skin tags. We'll commonly see skin tags, same kind of thing, and it seems to be the person. Some people will produce both. Some people will produce a lot more skin tags. Some people produce a lot more cherry hemangiomas. And either way you look at it, we're looking at the very tiny blood vessels of the body having micro trauma. And that begins or begets macro trauma, which is now heart and blood vessel issues. So now we begin to see that, we'll crack blood vessels and they'll bleed, and we'll try to heal with cholesterol. And it's all, well, I shouldn't say all, but a big portion of it is vitamin C and vitamin E deficiencies. Now, there may be some other things, but again, if we keep hammering our blood with high carb intake, we're going to see these things more and more and more. And we're going to have more swelling on the body. So, quick fix, you cut out all the grains. Yeah, you need to probably get on a good supplement that's very high in natural vitamin A, not beta-carotene, but natural vitamin A, natural vitamin C, the full 500 things that make vitamin C what it is, not just a single substance out of the vitamin C complex like ascorbic acid that's not very good for us. We really need these full nutrients so that our body can begin to heal our blood vessels. So that's skin tags and cherry hemangiomas. Do count them. If you want to change your diet for a good month and watch half of them go away and count them again, go for it. If you've done that, respond to me. I'd love to hear about your stories. So next is wrinkles and lines on skin. So the first thing I'm going to do is talk about the lines on our neck. Sometimes you'll see people that have 2 lines across their neck. It's a classic thyroid. I often will see it, and I'll then look at their eyebrows to see if the outer third of their eyebrows are gone or very thin. That is a thyroid issue. By the time women or men go to the doctor saying, hey, my hair is falling out, I have no energy, I feel horrible, and they put them on thyroid medication, it's a bit down the road. But your body's already starting to tell you things about your own body. And so we want to look at these things. So when we see this stuff, we know that, hey, we have a thyroid that's not doing so well. And it's not processing protein very well. And so that's why our skin becomes wrinkled, or especially right through here does. Now the hair falls out because every hair is held in there by a muscle that attaches to that hair follicle and then to our body. And as we have low thyroid, we begin to let go of that muscle, and now our hair falls out. So for women, they just know that they're losing a lot more hair and they don't like it. Men, I'll ask them, hey, tell me about the hair on the lower part of your leg. I have lost a lot of that. That's a thyroid challenge. And so we specifically need to figure out what is your thyroid challenged about and how do we address it. It's not really one size fits all, but we will say that there's some endocrine issues. You're under a lot of stress. You're probably vitamin C deficient again, but you're probably iodine deficient. You're probably trace minerals deficient. And we really need to get a handle on how you handle stress in your life. So that's just, a little bit for the thyroid itself, but there's other things that have to go on. And so next is just the wrinkles on our skin. Those wrinkles start divoting in when we're losing vitamin C and vitamin E that makes our skin nice and moist or hydrated. So does calcium make hydration happen for us too. So we look at those three things specifically when it comes to wrinkles. But a fourth thing that becomes very important and often called the cosmetic vitamin is vitamin F, or ALA oil, essential fatty acid called alpha-linolenic acid. We'll find it in real butter, that's grass-fed cow, cream from a grass-fed cow, or we'll find it from flaxseed oil. So, a lot of flaxseed oil on the market can be rancid, so I do want you to be careful with that. Flax seeds that you grind up, I would keep in the fridge for sure, and buy them from a store that their turnaround is pretty fast. And so, you may not get them organic, but if they're rancid and they're organic, it didn't do you much. So go for just the fresher stuff that you see a lot of turnaround in their product. Next is rashes. Now, for those of you out there that are on nutritional programs, or maybe that you're I don't want to say medicating, but self-programming yourself with vitamins, and maybe you've got a cupboard full of vitamins, and you just take a kind of a handful of all of them. And let's say all of a sudden you start developing a rash. Well, rashes we don't mess with. Rashes tell us that your body has got into an infection that it cannot handle. And now it's trying to send it out through the skin, and that is a big complication you don't want to deal with your body. But if you're just having rashes generally and you're just noticing that I haven't changed anything, but I'm getting a rash, well, it's often calcium and it's often an allergy. There's something that you're eating that you're reacting to, because that rash that you see on the outside of your body is likely happening within your gut. Now again, this wonderful skin here keeps going right in and right through our body, 18 feet of gut. So if you see it on the skin, you see it on the gut too. So just like those cherry hemangiomas that we opened with, if you see those on your skin, you'll see them in the gut. You'll also see them on organs. So organs, their capillaries too will bulge out, and now they'll be on the organs of your body inside you, not just your skin. And so rashes, we want to handle that really quickly. We want to do some things like good calcium, good zinc, good copper, which is vitamin C yet again. You're going to hear vitamin C quite a bit because it's important to us. So again, rashes, don't want to mess around with those. And even itchiness. Itchiness can be a food allergy oftentimes. Another thing I would look at is look at the tongue. I have done podcasts on our podcast site, Revealing Wholeness, that talks about the tongue and what to look at for the tongue, what to look at on your nails, what to look at on the skin. So I go into it a bit more depth there, and you find the information good. So please go to iHeartRadio or whatever podcast site you use and look up our Revealing Wholeness. That'd be awesome. And next is bruising. So if our body's bruising, it means that now we're breaking the small little blood vessels in the skin, the capillaries, really easy. Especially if you see a bruise and you're like, I don't even know what I did. That's not so good. And so instead of our blood vessels, like we can see maybe a couple here if I push on them, they give. and they bounce back. Well, if my blood vessels don't do that, and instead they're very fragile and they break and now bleed into the interstitial fluid around the blood vessel, we call that a bruise. You're looking at dead blood cells that aren't exchanging oxygen, and so they're dying and they look black and blue. That's what a bruise is. So our blood vessels are now breaking and bleeding, which vitamin C and vitamin E are supposed to keep them healthy and whole and healed, along with protein and some other things. But for the most part, it's usually lacking a lot of vitamin C and vitamin E in the blood. Now, last, I want to talk about keloid scars. Now, some people, they'll get cut and they raise this really bumpy scar. Their skin does not heal well. That is a lack of vitamin E. And wheat germ oil is excellent to rub on a keloid scar, but any scar, surgical, tattoo, anything like that on the skin that you've had that's a fairly deep wound, excellent with wheat germ oil. Let's say you've just recently had a surgery and you can now pull that off and you see that it's red and inflamed. Wheat germ oil is excellent, but here's the rub. If you buy wheat germ oil in a bottle and you crack that bottle, let's just say they did it in an oxygen-free environment and they actually got that wheat germ oil in that bottle and cracked that top on there. The moment that you pop it off, you got 36 hours to use all that wheat germ oil. Doesn't matter if it's in your fridge. It's going rancid. It's not a very stable oil. And so if you do any wheat germ work, which I do with clients, I always do it in a little caplet, poke a hole in it, rub it on. You got about 4 or 5 applications over maybe 2 days, and then don't use that caplet anymore. I'll put wheat germ oil on my skin when I go out in the sun to sunbathe because I want to make vitamin D. So I'm going to actually protect my skin but also feed it at the same time. It's a great thing to do. So last, I want to talk just briefly about essential and non-essential tissue. So we talked about thyroid, but I want to dig in just a little bit deeper when we let go of hair and see things like balding, or we see wrinkles or things that may be thyroid related. Men losing hair on their legs, even women they notice, hey, I don't have to shave as much. That's actually not a good thing. That's your body saying, hey, I am hoarding nutrients into my core and not allowing it out to the skin, hair, nails, and joints. So I'll see clients in with chronic low back pain, chronic neck pain, and I'm thinking, am I just dealing with massive deficiencies that their body literally is letting go of joint material because it's just got barely enough to maintain heart function, lung function, liver function, pancreatic function? I'm watching a body slowly go away and hoard in on itself. So as we start feeding you and doing things better, we should start seeing, hey, my hair is coming back, my eyebrows are getting a little bit thicker. Those are all natural things that we will see as a body gets better and better and better. So 2 weeks ago, we talked about high-octane foods. So if you're wondering what foods would give me good nutrition, please go back and re-watch that Facebook Live on high-octane foods. I listed 8 that were really quite easy to get to, and oftentimes they're not that bad. You know, people think, oh gosh, you're going to tell me this, that, or thing. Yes, there are those on that list, and there are ways to get them in your diet, but overall, that's the way you should be moving. And my clients notice that as they get better and better at their dietary choices, all of a sudden their taste buds change. You know what? I find myself actually enjoying a salad. I find myself enjoying honey. I find myself enjoying other things that I didn't think I would like. Or my palate for vegetables is now much broader. I have a much more eclectic palate. And I want different vegetables, where before I would never eat those. That's commonplace. As your brain tastes these things, it says, oh, I like that. You should like that. And all of a sudden, hey, I like that. That's normal, and those things will happen. So that's what the skin tells us. Now, we didn't cover some things like pulling up the skin, hydration, and scratching the skin to see if it creates a red welt. Do we have adrenal fatigue, all that kind of stuff? We're just simply looking at the skin. And so now you can start looking at your friends and neighbors and loved ones. Hey, I think you got some thyroid things going on. Hey, cherry hemangiomas, you might have some heart problems. That's a true statement. One crease that I want to cover about heart problems that we're going to end on is creases in the ear. I've seen literally massively deep, gorges in ears on both sides, and that is ischemia, which means lack of oxygen to a tissue. So when we have a heart attack, it's an ischemic condition to the heart muscle, and it dies. And we call that a myocardial infarction,